Thank you very much for joining us today on the program Healthy Living. I am Adesuwa Usa Uwage. Today on Healthy Living, we're going to be looking at caring for the eyes. A lot of us put substance in our eyes that we do not even know the implication of what we're doing. Others will say, oh, rather than go to the hospital, why not squeeze a little bit of onion juice into your eyes? Why not squeeze bitter leaf juice into your eyes? Why not do scent leaf into your eyes? Meet a nursing mother, let her squeeze a little bit of breast milk into that eye. Or some will even use local gin to wash their faces, all in the name of trying to protect their eyes, particularly when they have conjunctivitis, what we ordinarily call Apollo. Why do we do all of this? What are the implications? When your eyes are itchy, what do? Do you just go to the tap wash, or you get one thing or the other? What about those who go to the pharmacy just because their neighbor uses one particular kind of eye ointment or eye drop? They go and buy it without knowing if that's going to work for them. So today we're going to be talking with Dr. Bright Azeta, who is a consultant ophthalmologist, and he will be telling us everything we need to know about caring for our eyes. And you can also call in. Somebody actually called me last week to say that the daughter is constantly tearing, you know, like bringing tears constantly with her season. So this is your chance to call in to ask the doctor what and what you should do to care for the eyes. But before we meet the doctor, there is this thing that is ongoing now. We've been investigating this since December last year. For those of you who enjoy pepper soup delicacy, cow tail, cow head, goat meat, you name it, you have to be very careful. I'm not saying that it is not good to eat all of this. It is quite good, all right? But if you make it at home, it makes it a lot safer, all right? Because last year, particularly in December, there was this story that went viral that all these mama puts, most of the mama puts are using analgesics like paracetamol or Panadol to cook their cow hides or cow head or cow tail. You know, that part of the cow is usually very tough. So to make it soft, you have to cook it for a long time. But because they want to save cost, not knowing the implication, not knowing the health hazards they are causing or inflicting on their customers, they use this substance to cook meat. And they say that it makes the food to get cooked on time. Constant consumption, according to specialists in this field, have revealed that when you consume these meats from most of these mama puts that have been cooked with paracetamol or Panadol, it will definitely disturb your kidney, your liver, and of course, some other organs internally, and you will become sick and may even die. Ordinarily, these are drugs to ease pain. When you're in pain, when you have headache, you take these drugs and then you'll be free from this pain, you'll be free from this headache. But researchers and experts have told us that when these drugs come in contact with heat, you know the kind of heat we use in cooking, most women will know, some men do cook too. You know the kind of heat we use to cook this meat? Some use firewood, some use gas, but the heat is 100%. When this substance, particularly the chemicals that have been used to make these drugs come in contact with excessive heat, it becomes toxic. It becomes poison to your system. And this poison goes straight to your liver, to your kidneys. And what will you do when it happens? You know, and most of us don't like going to the hospital. Some will just bear the pain. They take one concussion or the other. They just go to their backyard, pluck 1, 2, 2, 3 leaves. Before you know what is happening, you may even have cancer. So the health implication of this is very enormous. So for those of us who are food vendors, those of us who sell food, we should be very careful what we do. Because we're trying to make money does not mean that we should inflict, pains on other human beings that may lead to their deaths because the health hazard, you just cannot quantify it, okay? So most persons who visit these food vendors everywhere and anywhere, be very careful what you eat. Apart from the fact that they use all of this to cook meat, they also use this substance to ripen our fruits. And consuming these fruits may also lead to death if you're not careful. So we'll take a very short break, and when we come back, we shall be talking with Dr. Bright Azeta. Stay with me. Thank you very much for joining us on the program, Healthy Living. What is the kidney?
The kidney is an excretory organ in the body, which is for metabolism.
Tuberculosis affects many organs in the body, but the common ones it usually affects is the lungs.
Epilepsy is a neurological problem.
Okay.
It is an injury in the brain, which causes someone to begin to convulse, to go into fits.
It is curable, but the cure is a long-term thing.
If you eat well and avoid those risk factors that will make your immunity to be down, then the risk of contracting tuberculosis will be reduced.
If you're healthy, then you're wealthy. All right, thank you very much for joining us again on the program Healthy Living this beautiful Monday on Independent Television. I did say that we will be talking with Dr. Bright Azeta, who is a consultant ophthalmologist from St. Teresa Eye Center. You're welcome, doctor. It's been a while.
Yes.
Okay, the last time we met on this platform was actually 2019.
Yes,
so this is 2020. That's awesome. Nice to have you join us.
Yeah,
all right, doctor. Today we want to look at care for the eyes, you know. A lot of persons, when they have eye problems, they do quite a number of things to the eyes. Let's start with the kind of diseases that may affect the eyes.
There are a lot of diseases that can affect the eye. And we have a large range of them, and some of them causes irreversible damage, and some can be reversible. Some are avoidable, and some cannot be avoided. It's good for us to know that those that can be avoided is about 80 to 80% that can easily be prevented or treated.
Okay.
And for those diseases, it is very painful when people get blind from them. For the avoidable blindness,
80% can be avoided.
Yes, 80% can be avoided. And from those avoidable causes, generally worldwide, cataract takes the bulk of it, and cataract can easily be reversed.
Okay.
Then we have glaucoma, which can also cause blindness, but it causes irreversible blindness, unlike cataract that can be reversed.
Can be reversed.
But the good thing about glaucoma is when you see it early, you can prevent blindness from glaucoma. We have other causes of blindness like refractive error that can easily be corrected with glasses.
Okay.
Then there are other conditions that we should know and know what to do, not just necessarily taking advice from our neighbors or non-professionals. Okay. We have other conditions like diabetic retinopathy, where for those that have diabetes, diabetes will not affect the eyes. Diabetes can affect any part of the body. It can affect the eyes, and it is cost-effective to treat diabetes than to treat the complications of diabetes, like diabetic retinopathy, which is very expensive to treat.
Okay.
Then we also
so how does that happen? What are the symptoms? What are the signs?
It's still poor vision, but usually it happens to people with diabetes, long-standing diabetic patients that are not using their medications. Even those using their medication, they can still have it in the mild form. Okay. Okay, but if you're not using your medication, because we have type 1 and type 2, especially for the type 1, they can easily progress to having diabetic retinopathy. Okay. Then when they have diabetic retinopathy, there's poor vision. And when they start having poor vision and they come to the hospital, and it depends on the stage of the eye, of the diabetic retinopathy. That's what will now determine the mode of treatment. Okay. So we'll go on to talk about, so we don't dwell on diabetic retinopathy because we'll be talking too much if we want to dwell on
let's concern ourselves with the one that can be reversible. You talked about 80% of this blindness can actually be reversible. Let's talk about how this can happen, because a lot of persons do have eye problem, but going to the hospital is a problem. Rather, I want to ask my neighbor, oh, you're wearing glasses. Let me see if your glasses will size my eyes. Oh, you're using this eye drop. Let me see if this eye drop can work for me. You know, that's always the culture.
Yes, it's good to know that care of the eye starts from when we are born to when we die. We have to care for the eye starting from when we are born. The parents or the caregivers, they have to take care of their child properly. So I want to talk about, because there are some conditions that can affect the child.
Okay.
So when you give birth to a child and you see something that is abnormal, for example, there is whitish opacity on the child's eye, on the black part of the eye, you should be able to see an eye care professional. On that black part of the eye that's supposed to be black.
Something whitish.
Sorry. Or you notice that the child's eye is deviated, or there's discharge in the eyes, for example. You don't just go ahead and start listening to mother-in-laws, friends, neighbors, sisters, brothers that say, put cow urine in the eyes, put breast milk. A lot of them,
onion juice.
Yes, a lot of them, they come to the hospital with blinding conditions, and we cannot reverse it. We've seen a lot of children with this kind of conditions. You might have done it and nothing happened, does not mean that it is right.
Okay.
Sometimes people say they use it and it worked. That condition might just be a self-limiting condition. Those things cannot cure the eyes. When we have eye condition, especially for children, because these children, they cannot talk, we should see an eye care professional. It is very important. I cannot take my car and go to the doctor for the doctor to fix my car.
No,
it will be strange. It will be strange for the doctor. I will drive my car.
It will be laughable.
Yes. So I don't expect. But we cherish our children more than our car. But we take our children to quacks. We listen to people that are not professionals to take care of our children. We should not do that, because most times those conditions cannot be reversible. You
know, sometimes parents see it as a thing of shame, as something to run away from, as you know, like living in self-denial. They have seen that their children cannot make focus, they cannot focus on an object, or the eyes are deviating, like you said, or maybe sometimes the eyes are teary, you know, the eyes brings tears constantly, or there's anything in the eye. What will my neighbor say that this newborn baby is suffering this condition? You know, it's usually, it's not my portion thing, and then they start to like patronize one neighbor or one local herbalist or one other person or the other, rather than going to the specialist. Let's talk about this thing of stigmatization. Why is it hard?
I think it's more of awareness and ignorance, because if you are aware of what is there, or the fear of the complication of what is there, you will not go to the roadside person. You will not, you want to see an eye care professional instead of just putting that stigma that condition might create. You overlook it if you really know the danger of that disease. For example, if you have a blinding condition, for example, like retinoblastoma, the eye is white, and that can blind the eye, it can kill the child. If you know that that can happen, then you will not go and see somebody that is not a professional. Of course, the whitish opacity might just be corneal opacity that is nothing, that is not really of danger to the life of the patient.
But at least seeing the doctor is important.
It's important. Then if it's also, it can also be cataract. If there's whitish opacity, it can be cataract. And the earlier you operate the cataract by a trained personnel, the better the outcome, the visual outcome. Because if you leave a child with cataracts, because children can be born with cataract, if you leave the cataract for a long time, it makes the eye to be lazy. The eye will not be able to mature to full maturity, to get to that full maturity. So when that child is old, even after the extraction of the cataract, the vision will not improve significantly. When you know those things, that okay, the earlier you go to the hospital, the better the prognosis, you will want to come. So that is why we are here to encourage people at home that when you see any condition in the eyes, you make sure you see the eye care professional. At least let them tell you, oh, it is nothing. It is not a problem. Don't just listen to the, some people will say, the child is just 2 days, it's just 1 week. You have to wait for 3 months, you have to wait for 6 months. Sometimes that is what they say when they come to the hospital. You say, when did you notice it? They say, I noticed when they gave birth to the child. So when did you come? Somebody said it's too small for surgery. Sometimes they come to the hospital, we tell them, okay, this is a surgical case. We need to do surgery in the next maybe 1 week, 1 month. They'll go home, the neighbor will tell them, don't worry, just wait for 6 months. That was how they did my neighbor's son. That was how they did my brother's son. They will take the advice of their neighbor
rather than the professional.
They will not come. Maybe after 1 year, when there's no complication, they will not come to the hospital and say, it's not too good. We should try to believe the healthcare professional when they talk.
All right, let's look at the issue of wearing glasses on our kids. Is anything wrong?
Yes.
Why should we allow our kids to wear glasses? You see children of like a year, 2, 3 with glasses.
Children, I'll first of all talk about how you will know that the child needs to see an eye care professional. For example, when you see a child, anytime he wants to watch the TV, he or she goes close to the TV. When he wants to look at a book, he takes the book very close to the face. The child might want to stay indoors. He can play with toys, but will not want to play outside. You should suspect that child is not seeing well. And there's most of these children in class, if you put them at the back, they don't see.
They don't see.
Put them at the front, they might even see but struggle to see. 80% of what they learn is from visual, what they see. 80% of what they learn. A growing child, if he's not seeing, he will not learn well. So he'll be backward mentally, might be socially withdrawn from his peers because he cannot really see what they see. So he doesn't see the environment the way his own peers see. So you think, this child is shy, this child is dull, this child, no. It's because this child cannot see. So you have to understand that part that you need, even for the physical growth, you need vision. For the mental growth, you need vision. So at that point, if a child needs glasses and they tell you that this child needs glasses and you don't avail the child to the hospital where the child can be checked and probably given glasses, the child will not mature or develop in some certain ways the way it's supposed to be. So it's very important. Some people say that it's good for me to quickly say that those that need glasses is not a disease. It's just a refractive error, just like being tall, being short. If you are short, you don't start looking for drugs or praying for you to get tall. It's not a problem. So when somebody has the simple refractive error, it's usually not a problem. All you need is the glasses to help you see clearly. For you to see clearly, that means the eye is fine. We have to understand that. So we should not see it as a stigma that, oh, the child is too small, or when the child starts using glasses, the power will go high. So they delay or they wait or they never ever want to take because they feel that it will worsen. First of all, you must know that refractive error is not a disease. That's one. Then two, we should also know that the glasses does not worsen or treat anything because there's no disease in the first place. So the glasses is just for the child to see clearly. Sometimes, at some point, if, for example, if a child is like 3 or 4 or 5 and needs glasses and you give it to the child, sometimes, maybe at 12, the child may not need the glasses anymore.
Sometimes, not all the time.
Sometimes the power might change, that you might need to change and use another glasses. But the power changes or becomes normal and you no longer need glasses, not because of the glasses that the patient has worn. So it's just the normal growth of the eye. This refractive error can be as a result of small eye, big eye, or the curvature is not curved the way it's supposed to be curved. So as the eye is growing, it might attain or that normal growth or outgrow the normal growth. So when you have refractive error, sometimes it can get worse and you need to change your glasses. Sometimes you might outgrow it and you no longer need glasses. So it's both ways.
Is it same for adults? Maybe
usually
glasses for a while and after some time you don't need it anymore.
Usually for children, why it's like that? Because the child is still growing, so the eye is still growing. So the power of the glasses might change. For adults, when they attain that age, about 18, when it's no longer growing, for most adults at 18 it stops growing. You might not necessarily need to change your glasses like that for distance, but still you can still change it because it's not just about the growth. It's about the curvature. It also depends on the curvature and the state of the lens in the eye. So there's a whole lot of things that can affect the refractive state of the eye. So it can still change, but not like that of the child. Then again, at 40, those with normal vision will likely need glasses for reading small print.
At 40?
At 40. Those with normal vision will likely need glasses, except you don't do a lot of visual tasks. For those persons, by the time they start needing glasses, it might start gradually. They notice that they have to take small letters away from them to see. So initially they manage and manage and manage. On the time they can no longer manage because they think it's
an arm's length.
Yes, it becomes an arm's length. And sometimes it can be very disgraceful when they go for maybe programs and they give them paper to read, maybe in church, and they are struggling to read.
You're stretching your hand so far.
And maybe that person is just a school teacher, and people will not be wondering, but he's a school teacher, he cannot read. He's a PhD holder, he cannot read. But just because the person is not wearing the glasses. So it is good for you to know, don't just struggle. Using glasses at that age is normal. As we age, the eye also age. It's a normal process. The muscle in the eyes, the lens in the eyes cannot deform and change shape the way it's supposed to change, just the way we start having wrinkled skin, white hair. So it's a normal state that you will not need glasses for reading. Some persons will never need glasses. So you don't compare yourself with, oh, that person never used, my father never used glasses. At 80, he was still reading without glasses. Myopes, most of them, they never need glasses for reading till 80 because they cannot see far, but they can see near.
They can see near.
Yeah, so those persons, and some persons who need glasses before 40. Those are maybe hypermetropia. They can even need glasses before 40, for reading. So it depends. So we should not just say, okay, you compare yourself with another person and say, I will not use glasses. So it is very important that we know these things. Okay,
apart from all of this, let's quickly look at cataract, because you said it's something that is reversible. I know that some persons have, but the fear of surgery is so huge that no, they would rather keep the eye that way rather than going to operate it. So let's talk about the implication of that. Can it lead to blindness permanently without reversing it? That is when the person decides that, okay, I want to have an operation on this cataract. But before then, just describe what cataract is like to us.
Cataract is the clouding of the lens in the eyes, which impairs clear vision.
Okay.
The eye has a lens, and this lens is like the lens in the camera that helps you to focus. Without that lens in the camera, you cannot see things clearly, to not be sharp.
Where exactly in the eye do you see it? On top of this black?
No, the lens is, I would say, is at the front part of the eye, but not that you can see it. You cannot see it with your eye. Okay. It's at we have the anterior part and the posterior part of the eye. It's still at the posterior part, but maybe like at the back of the anterior part. So it's inside the eye. It's very small. It's not something that you can see from outside. Okay. So that lens is what helps you to focus. It's normally transparent. With age, like I said, the eye is aging as the body is aging. Majority of the cataract is from age, is from aging. It's from aging process. So when that transparent lens with age becomes whitish, and it goes gradually. With that, the vision becomes cloudy. You hear patients say that I can no longer see far. It's like there's smoke in front of me. It's like there's cloud in front of me. Okay. Some of them will tell you, in sunlight, I cannot see at all. In the cool evening, sometimes it is better. I can no longer read. But sometimes there are different types of cataract. There are some that can give you a second sight, what we call second sight. Okay. Those persons, initially they will be able to see far, but later they will notice that they can no longer see far, but the glass, they will no longer need glasses for reading. Okay. So we call that nuclear cataract. Okay. Not all nuclear cataract will do that, but sometimes they can have, they will no longer need glasses for reading. They can read without glasses, but distant vision is impaired. Yes. So these are some of them. At night when they drive, they can no longer drive because when light enters the eye, it scatters inside the eyes, causing glare. So it dazzles them. They can no longer see when you shine light in the eyes. So it goes gradually until it covers the eyes completely, and it causes total blindness. But we don't really worry about cataracts because, like you said, it is reversible. It's completely reversible with cost-effective surgeries. It's not like, yes, people are afraid. There are lots of reasons why people don't come to us for cataract surgery, or even when they are aware. Sometimes, first of all, is the fear of the surgery. Sometimes they are not aware of this that surgery can be done. And sometimes they are aware, but they cannot accept the treatment. Because once you tell them it's operation, they say, no, God forbid, I will never do operation till I will live like that. Some of them is accessibility to the hospital. They live very far in villages where they cannot really access good health care. Some of them don't know where to go, the actual place to go. Then we also have the factor of the facilities. We don't have these facilities in the rural areas. They have to travel very far, and sometimes we have them in the urban settings, and you don't have enough manpower. And sometimes you have the manpower, you don't have the equipment.
You don't have the equipment.
Or sometimes you have the manpower, maybe you just need further training so that.
So the challenges are huge.
So the challenges are huge for cataract. But again, I would say now things have changed.
Okay.
It's not like those days where cataract surgery was a big deal.
Okay.
Now you can get your cataract surgery done with good visual outcome, and recovery is almost immediate. Okay,
you did say that cataract comes with age. What about children who suffer from cataract, or is it impossible for children to have cataract?
Children, at birth, they can have cataracts. Some children can be born with cataract.
Why would children be born with cataract?
It can be hereditary. It can be from genetic defects. So, and also it can also be from trauma. It can be from infection from the mother during pregnancy. There are a lot of conditions that can cause cataract in children. Okay. So when there's cataract in the child, usually when you give birth to the child, or maybe when the child is like 1, 2, or 6 months, you start noticing this whitish opacity in the eyes. So when you have something like that, you have to take the child to the hospital. So cataract can affect a child. And when it affects the child, it's not like the adult where you might wait. You don't wait. When we see cataract in the child, we want to remove it as fast as possible.
Immediately.
So that the eye does not become lazy. Because if you wait for 1 year, 2 years, by the time you operate it, that visual outcome that you expect will not be achieved. Okay. Yes.
All right, the program is Healthy Living on ITV. We're talking with Dr. Bright Azeta, who is a consultant ophthalmologist from St. Teresa Eye Center here in Benin City. Phone lines are now open. You can call to ask any questions that have to do with your eyes. We're talking about the eyes today, so don't call me to ask about fertility or hypertension, diabetes, or any other disease. Let's keep to the eye, okay? Let's look at the eyes, because so many people are suffering without even knowing where to go to. You have a chance. This is part of our social responsibility to you as, very wonderful, ardent viewers, okay? We'll do this for you, because without you, there will be no us, all right? So call in. If you have anybody, or you know anybody that's got one eye condition or the other, just call, ask the doctor a question. It won't hurt you, okay? It won't hurt you. Rather, it will like boost your morale a little bit, and then tell you where to go to. At least you know your fate, you know what to do. So if you have any eye condition at all, call in and then let the doctor give you an explanation. The presenter, he's the expert here, he's a consultant ophthalmologist, okay, and is very trained when it comes to cataract and a glaucoma issue, okay. Indian trained, I remember that time, yeah. So give him a call. Let him help you a little bit, okay? So the number is 052-290573. The number is going to be right there on your screen. At this point, let me quickly say thank you to Etim. Yeah, he's doing a wonderful job. All the visuals you're seeing on TV is Tony Etim's work. So thank you, Tony Etim. All right, before the calls start coming in, doctor, let's look at glaucoma now, the one that is irreversible and very, disheartening, so to speak. Tell us about glaucoma.
I would like to start that glaucoma is the silent thief of sight. We take it very seriously. We look at it critically when we see it. Glaucoma is a condition that can cause irreversible blindness. It's the #1 cause of irreversible blindness and worldwide, and it's the #2 cause of blindness after cataract. What is glaucoma? Glaucoma affects, I would say, the back of the eye. There's the optic nerve that connects the eye to the brain.
Yes.
So it's like a wire that sends information from the eye to the brain. The glaucoma affects the optic nerve in the eyes. And it affects it in such a way that any damage that it has caused, you cannot reverse it. Okay? So, and there are some things, we cannot really say this is the cause of glaucoma, but we'll say predisposing factors. And the number one factor that is most important among these is elevated intraocular pressure, the pressure in the eyes when it's high.
No, please, you have to break that down for us now so that the layman would understand.
We have the eye just like a ball. If you pump it, there's pressure in the eyes. The eye is a ball. When there is pressure in the eyes, when the pressure is high, it can cause damage to the eyes. The normal intraocular pressure, I would say statistically normal pressure is 10 to 21 millimeter of mercury. That's the normal. But we cannot say that if it is normal, you cannot have glaucoma, because we have different type of glaucoma. We have the high pressure glaucoma and the normal pressure glaucoma.
Okay, doctor, we'll continue. Hello, caller. Good afternoon.
Hello, good afternoon.
Yeah, tell us your name and then ask your question, please.
My name is Samuel.
All right, Samuel, ask doctor.
Hello, good afternoon, doctor.
Go ahead, Samuel.
Please, what is the cause of reddish eye? If your eye is white and now it's somehow reddish, what is it? Is it a problem, an infection or what?
Okay, the cause of reddish eye, mostly at night, yeah?
No, normally, it has been white ever since, but for Christians.
Okay, like how many months ago?
Like a month plus.
A month plus. Okay, doctor.
When you have reddish eye, a lot of things can cause it. I cannot start naming the causes because there are a whole lot. Infection at the surface of the eye, at the conjunctiva, the eyelids can cause it. Infection on the cornea, that's still the front of the eye, can cause it. You can have inflammation inside the eye. All this can cause it. Then even some type of glaucoma can even cause it. There are a whole lot of conditions that can cause red eye. So when you have red eye, it could be innocuous or sight-threatening, and it could be life-threatening. So majority of them are the ones that might resolve on their own.
Okay.
So I'll just quickly talk about some common causes of red eye. You can have bacterial infection. So when you have bacterial infection, that's when you start having discharge in the eyes. Yes. It gums together in the morning, becomes red, sometimes becomes heavy. For that one, you can easily treat it. When you have it, it's good to come and you see the healthcare professional, because it might not just be as simple as it is. Sometimes it can be simple. You just go to the chemist, they give you drugs, it will heal. We've seen a lot of times people who have that kind of complaint. They go to the chemist, they give them wrong drugs, and they become blind. By the time they come, we can no longer do much, because sometimes they give the wrong drug. And when you give the wrong drug that is for another condition, you give it for that condition, the eye will deteriorate. So even if it is simple, I will not say you should just go to the roadside and get drugs. Because see a doctor. That infection, there are different types of infection. It can be viral, it can be fungal, it can be bacterial. There are different ways to treat them. When you come to the hospital, we'll look at it, examine you, we will know the type and give you the appropriate drug. Then it can also be allergic.
Okay.
People have recurrent itching in the eyes. Yes. And this recurrent itching, usually it starts when they're small, about 5 years old, and they have recurrent itching.
Hello, hold on, caller.
They have recurrent itching, redness, tearing. They feel as if there's sand inside their eyes. Sometimes it's self-limiting, it comes and goes. Sometimes it comes at a particular period, maybe during the rain, or sometimes in the house. To notice that anytime they enter into their house, maybe the house is dusty, or when they go to a particular environment, they notice this tearing. Because when you are exposed to those agents that cause allergy, it aggravates, precipitates it, and you start having the itching. So it comes and goes. So those are some of the causes. Then also, you also have some infection in the cornea. Infection in the cornea is something that is dangerous. It's something that we'll take very seriously. When you have infection in the cornea, your eyes can be red. It can be painful. And sometimes, within hours, your eye can be blind and you will have irreversible damage. Sometimes within days. Yes. So when you have red eye, you will not just say, oh, it's a simple bacterial condition or it's a simple allergic, except you already know, they've already gone to the hospital, they've told you that it's allergic conjunctivitis. Oh, this is what you use when you have it. But when you have pains with it, it's a red flag. Pain and redness is a red flag. In fact, outside the eye care professionals, you should not treat the eye. But when you have redness and pain, is telling you that there is something that you really need to look at. Because corneal blindness is something that is irreversible. Even if it is reversible, you spend a lot of money, where you'll be sending up to ₦1 million, and to get it fixed, and sometimes it might not be as good as it was. Or most times cannot be as good as it was. So it's better to prevent it. So those are things we call needless blindness. Things are not supposed to cause blindness. But it causes blindness because of ignorance, awareness.
Okay.
Okay.
All right. That's quite enlightening. 052-290-573 is the number to call. We're talking the eyes today with Dr. Bright Azeta. Hello, caller. Good afternoon. Hello, good afternoon. Please tell us your name and where you're calling from.
Esther.
All right, where is Esther calling from?
Igbo.
All right, Esther, ask the doctor your question.
Ma'am, I hardly see clearly, I'm far.
Okay, you hardly see clearly and you don't see far. All right, Esther says she hardly see clearly and she can see far also, so.
The question I would like to ask her, if she's still online, is, have you seen the healthcare professional? Because that's the first time.
No, she just said her mind and left without waiting.
Yes, it's good for us to know. I'm not just speaking to her, I'm speaking to every other person. When you have an eye condition, it's not just to wait for a program before you come. The program, yes, we need to explain to people what all these diseases are. But when you have a problem, you don't wait to ask somebody, you see an eye care professional. Okay. When you have poor vision for distance, it can be the simple refractive error that can easily be treated by the use of glasses. So I will assume that it's though I didn't have that time to start asking her questions, but the bottom line is that she should see an eye care professional.
All right, Esther, if you're still there, you see an eye care professional. Hello, caller. Good afternoon. Good afternoon. Please tell us your name. Your name is? Okay, Chinyere. Where are you calling from, Chinyere? Reduce the audio level on your television set, please.
All right, ma'am. Hello, ma'am.
Hello, I can hear you better now.
Hello.
Hello, I can hear you.
My daughter have eye problem.
What's the problem?
The eye just scratch her, and it's very painful.
The eye, they scratch am, and waiting else?
And it's pain and serious.
They pain her. You don't see doctor?
Yes, I go to the old road. It's a military-based old road.
Okay.
But I don't like, you can't understand it. They tell me there we buy glass. Now, I don't ask her, what's the problem of the eye? Then nobody tell me anything. And I spend a lot of money.
Okay. You don't go another government hospital?
Hello, ma.
You don't go another government hospital?
I did not go any other apart from that military-based hospital.
Okay. As you not like what they tell you, for try UBTH or Stella Obasanjo. Chinyere, go to UBTH or go to Stella Obasanjo. Can you hear me?
I'm hearing you.
Okay, go to UBTH. They have a good eye center there. If you go to Stella Obasanjo, they also have good eye center there. Otherwise, you wait to the end of this program. I will call out a number for you.
Okay.
All right, doctor. Let's talk about glaucoma while we wait for other calls. We're talking about it. Hello? Hello? All right, no call yet.
We talked about
silent T for SAT.
Yes, that can lead to irreversible.
How do people know? How is somebody? Do you self-diagnose or you have to go to the hospital? What are the signs? What are the symptoms?
Number one symptom is that there is no symptom. That is yes.
That's
the number one symptom. There is no symptom.
There is no symptoms.
And that is why we call it the silent thief of sight. So it's like this. Most times we diagnose it when people just come from routine visit or they come for other conditions. So usually it starts because the way it takes your sight, it takes it from the down, up, and the side. The central part is clear, very clear. So the glaucoma patient will tell you, I can see far. I can see near. Usually they don't have any complaint. Sometimes they come to the hospital with because of itching, because itching, glaucoma does not cause itching. So it's during the examination we'll now see that, oh, there is a comorbidity, there is glaucoma. But usually it is symptomless. It's usually at the end stage or at the advanced stage you start noticing symptoms. At that time you cannot really reverse it anymore. Some persons, they will notice that at that advanced stage, maybe some drivers will tell you, I easily get accident now. But maybe that will be the first time they will now come to the hospital and will not see it's at the advanced stage. Some people will just notice that they can no longer walk well. They have to walk carefully. They fall easily. They step on things, kick things when they walk. So for those people, the peripheral vision is affected when it's advanced. But usually, because there are different types of glaucoma, we have the open angle and the closed angle. The majority in these our localities, the open angle, about maybe 90% open angle glaucoma. Open angle glaucoma will not usually cause pain. Even the closed angle glaucoma, yes, it causes pain, but for majority of these persons, they will not still have pains. So I would say that it is symptomless. I will not start talking about the symptoms, because if you wait till you start having symptoms, then you will present at the advanced stage. And at that advanced stage, there is nothing we can do. So when are you supposed to come to the hospital? That would be the question. Okay. Because it is symptomless, except you want to wait when it is advanced.
Is it an age thing, or anybody can come down with glaucoma?
Anybody can come down with glaucoma, but usually it's, I would say, it's an aging thing that usually at 40 and above, you should get your eyes checked, because that is the time it starts manifesting usually. But children, they can be born with glaucoma. When a child is born in glaucoma, usually the eyeballs, they are bigger than normal. The black part of the eyes might look white. So when you have that kind of condition in a child, you will need to see an eye care professional so that they'll be able to know if it is glaucoma or not. And if it is glaucoma in the child, usually it is surgical. You do surgery for children with glaucoma, so it doesn't lead to blindness. Some people, they will leave their children, start putting traditional eye medication. Sometimes the eye will burst open before they come. And at that time, you cannot really do anything. So it affects the newly born. It can also affect anybody. But usually we say that at 40, you should get your eyes checked. Okay, at 40 you should get your at 40 you get your eyes checked. Then those with family history of glaucoma will not wait till 40. If a father is having glaucoma or the mother is having glaucoma, at that point you should check all your children and tell them that yearly go to the hospital and check your eyes, so that it doesn't progress.
All right, doctor, I wish we could go on and on and on, but fortunately, or unfortunately rather, time is fast spent. All right, I did say that I was going to call out a number for those of you who really want to get back to us on this program. Okay, you can do a follow-up by calling this number 080-3699-6388. 080-3699-6388. Okay, so call this number and you'll be able to do a follow-up on this particular topic that we've treated today. So I want to say thank you to Dr. Bright Azeta.
Thank you very much.
He's a consultant ophthalmologist from St. Teresa Specialist Eye Clinic here in Benin City. We'll see you again on Monday. Until then, please take good care of your eyes. Bye-bye.